There are many other aspects that we have to consider while discussing unawareness, ignorance, and stigma about mental health issues. We generally expect that in society, those people who are at a privileged position, they are educated, they are concerned with medical science, or doctors, or nurses, or medical students, possibly will have a better understanding and will not be so stigmatized. But unfortunately, that's not the case. All these people are drawn from the same section of society. There is something very basic and common which is deep rooted, which they have not been able to crack with the level of their education as well. For example, if you measure stigma in nurses, in medical students, in consultants, family physician, and other doctors, they all show significant level of stigma about mental illness, prejudice against mentally ill person, the type of treatments they choose for mentally suffering, for individuals suffering from mental disorders, also gets affected by their attitude, understanding, and prejudice. Why it is so? Because as I explained in the beginning, the negative image of something called mind is so dark, so vivid, so deep rooted that so far we have not succeeded in dealing with this problem. Time and again there has been attempt to quantify it, identify it, find remedies, but it has not happened so far. For example, this study was done in New Delhi by my friend Dr. Nimish Desai. He's a retired director of EBHAS. And what he studied is attitude of undergraduate medical students towards mental illness and psychiatry. He designed a beautiful questionnaire and attempted to find out what is the level of problem with attitude towards psychiatry. And they found that they are common and affect more than 25% of people at some time during their life about mental illness. In spite of magnitude of people suffering from mental illness, people do not get adequate care they need, leading to increased overall burden to society. Recent National Mental Health Survey from 12 states in India had shown that lifetime prevalence of mental disorder in the surveyed population was 13.7%. Nearly 150 million Indians are in need of active intervention. Multiple factors ranging from lack of awareness to affordability of care influences their wide treatment gaps. National Institute for Mental Health Survey suggests that one major factor responsible for this is stigma. Stigma contributes to the huge burden of mental morbidity, being a roadblock to treatment seeking. Social stigma and negative attitude can affect the quality of life for people with mental disorders. An attitude is defined as a relatively enduring organization of emotionality linked learned belief around an object or situation predisposing one to respond to some preferential manner. Worldwide studies show that negative attitude among medical students towards psychiatry and mental illness. There may be obvious reasons for negative attitudes such as lack of accurate information about mental illness and lack of contact with individuals with mental disorders, so the lack of exposure. The assessment of attitude of undergraduate medical students towards psychiatry and mental health is an important, as they are the future care provider. It's very important that today's medical students carry correct and accurate and scientific information about the illnesses they are likely to treat in their patients in times to come. So here is this study which was conducted in 2016 and 17. A total of 1,980 usable responses were obtained. Most participants, that is 1,633, 86.4%, were unaware of any suicide crisis support option. Most commonly listed options were support from family member, peer group, counseling, and psychiatric consultation. These were also endorsed as most preferred support options. They concluded there is a low level of awareness about suicide support services among young Indian adults. There is a need for coordinated efforts to raise awareness and promote uptake of suicide support services in the group. So suicide is a common problem in students, and here is a study which demonstrates that majority of students were unaware about how and when and to seek help in a suicidal crisis. It's an important aspect of our life that even those who are well placed in hierarchy of education and income are not aware. And even if somebody is aware, not necessarily having positive attitude, the two are very different. Similarly, there are a number of other studies which have proved the point that it is the attitude that you carry since beginning which affects your overall thinking. You develop hate, prejudice, your basic emotion, hate, prejudice, repulsion to a condition because of cultural factors.